My name is Dr.R.Krishnan, an assistant professor from St.Joseph College of Arts and Science, Autonomous Cuddalore. I'm going to present the topic on rabies infection. Rabies is a deadly zoonotic neurological disease, and if you see the shape of this virus, they are bullet shaped, they have an envelope, and the RNA will be acting as a genetical material. And rabies, they belongs to the genus called Lissa virus. And the Lissa virus, it's a group of virus which belongs to a family called Rhabdoviridae. So rabies or deadly dangerous viral infection which will be affecting all group of peoples. So if you want to inactivate the virus, they can be done by using a disinfectants, soaps, and also UV light and also heat. So there are 7 Lissa virus genotypes has been identified, but rabies, which belongs to the type called genotype 1. The remaining 6 Lissa virus genotypes primarily infect bats and less frequently cause fatal human encephalitis. So which is clinically indistinguishable from classical rabies. So next is, what type of host can be affected by the rhabdovirus? So normally all warm-blooded animals are highly susceptible to infection. Example, wolves, foxes, dogs, cattle, raccoons, and mongoose. And moderately susceptible hosts like cat, ferrets, primates, sheep, goat, and horses. The next is mode of transmission. See how the infection can be transmitted. There is a mode of transmission. So normally the infection can be transmitted by biting of infected animals like dogs. So this dog, they carry the viruses on their saliva. On biting, they will be transmitting the virus to the host. Here the large majority of the cases occurs after a long dog bite. Then other routes of transmissions through corneal or solid organ transplantation in human patients. And sometimes aerosol transmission which has been reported, and ingestion of infected tissues or milk can also transmit the rabies infection. So next is, after transmission, the incubation period. In dogs, the incubation period varies from week to many months. And most rabies cases in dogs develop within 21 to 80 days after exposure. But the incubation period may be shorter or considerably longer. The outcome after a bite from a rabid animal include the proximity of the bite site to the central nervous system, the degree of innervation of the bite site, the age of the host, then the amount of virus inoculated, and also the neuroinvasiveness of the rabies virus variant involved. The course of rabies typically lasts 3 to 8 days in dogs. So next is the pathogenesis of rabies infection. The rabies enters through the peripheral nerve system or may replicate in monocytes and spread to motor nerve endings. Then through the intraaxonal way, they spread to the central nervous system and causing severe damages. This virus will be replicate mainly in the spinal cord neurons and spreads throughout the nervous system and causing a very severe problem called motor neuron paralysis. So virus enters the brain causing cranial nerve decline and behavioral changes. So next is the types of rabies virus. The rabies virus is generally of two types. One is called the street virus and second is called as fixed virus. So in case of street virus, the virus is just isolated from a natural occurring cases. And this virus or street virus are normally found in the saliva of infected animal and producing negri bodies in the animals. The incubation period is 2 weeks. It is pathogenic to all mammals, and it can't spread. It can be. We can't use this as a vaccination. So in case of fixed viruses, so this virus has a short, fixed, and reproducible incubation period, and it can be prepared by repeated culture in brain of rabbit, such that its pathogenicity is reduced and fixed, and it won't form any negri bodies. And we can use this fixed virus as a vaccination, like an anti-rabies vaccination. And the incubation period of this fixed virus is 4 to 6 weeks. So next is the clinical symptoms. The clinical symptoms or the course of rabies will be into 3 phases. One is called prodromal phase, second is called exudative phase, and third is called paralytic phase. In prodromal phase, the behavioral changes may occur. The person will be aggressive, and the person's having a high rise in temperature, and some of the excessive salivation may occur. In the second phase called furious phase or exudative phase, the dogs become severely agitated and restless, and sometimes develops the urge to roam. It is most dangerous at this stage because of urge to bite anything, that is, encounters. In most cases, an altered phonation, a characteristic high-pitched bark, develops, caused by paralysis of laryngeal muscles. If the dogs does not die during one of the characteristic convulsive seizures, the disease usually progresses to muscular incoordination, paralysis, coma, and death. The posture and expression is one of the alertness and anxiety with pupils dilated. Noise may invite attack. Such animal loss caution and fear of people and other animals. And third is called the paralytic phase. They can be called as a dumb rabies. Occurs when the exudative phase is extremely short or absent. The most characteristic sign is the dropped jaw caused by paralysis of the masseter muscles. And the infection can also varies between the animals. So in case of other cattle, their furious rabies can be dangerous, attacking and pursuing people and other animals. Likewise, in horses, the phases, incubation period can also vary. The next is the diagnosis of rabies infection. So based on the history and clinical signs, one can able to confirm the rabies infection, and also by using immunofluorescence microscopy on the brain tissues, so which can allow the direct visualization of antigen antibodies. And molecular testing like real-time PCR can also be used. The World Health Organization recommends methods for the detection of rabies virus is antigen, amplicons, and antibodies. So next is a treatment. So here the management of wound will be one of the important thing, and tetanus toxoid and antibiotics for wound healing. And prevention and control. All dogs and cats should be vaccinated for rabies at 3 or 4 months of age with a booster dose. Dogs and cats less than 1 year of age are not considered immunized until 28 days after the initial vaccination. The oral Vaccinia Vectored recombinant vaccine is used in wild animals such as raccoons and grey foxes. So oral vaccination of federal and wild animals. So the vaccination name is SCAD-B19 strain, a modified strain that can be used as a vaccination. And humans, so we're using a post-exposure prophylaxis is administered to human after a bite from an unknown or a suspected rabbit animal. Thank you.